It's a crisis. And
with the 10 to 15 new house patients the Guam Memorial Hospital receives on a daily basis, there should be at least 6 hospitalists to care for those patients who have no insurance and no doctor. GMH Department of Medicine Chair Dr. John Ray Titano says the hospital currently only has 3 who are threatening to quit due to an overwhelming workload.
So we're overwhelmed and not unable to get enough rest, seeing many patients, and it produces kind of an unsafe situation because the physicians are very tired, can't sleep because they're getting calls all the time.
The hospital is now looking to private physicians for help until more full-time hospitalists can be hired. But during a Department of Medicine meeting this morning, Dr. Titano says there was lively discussion about the idea that was met with resistance from a number of physicians who are opposed to having to take house call as they fear their private patients will suffer.
We were asking the private doctors, all the doctors in internal medicine, to provide hospital coverage, at least on a temporary basis until we get through this crisis.
Some of the physicians suggested that the Naval Hospital care for migrants from the Federated States of Micronesia to help alleviate the workload at the island's only civilian hospital that can't turn anyone away. Titano couldn't give a specific time frame of how long the hospital would need the physicians' help, but says without it, the hospitalist program will fail.
And if that happens, then all of us that are full-time will quit. And as a result of that, then all the hospitals that are now being taken care of by the 3 will go to all the department members, which means that everybody's going to be putting call 2, maybe 3 times a month.
GMH is already in the process of hiring a 4th hospitalist who has applied under a specific type of visa. The application review process was delayed due to the federal sequestration and has since resumed. Meanwhile, GMH Administrator Joseph Verga says he and the hospital board are currently reviewing whether taking house calls will soon be a requirement for those physicians who are granted hospital privileges. Reporting for Guam's News Network, I'm Mindy Egan.